I recognize the member for Fyzabad.
Thank you. Thank you very much, Mr. Deputy Speaker, for the opportunity to contribute on the Financial Appropriation Bill for 2024, the budget debate. First of all, Mr. Deputy Speaker, I would want to thank the constituents of Fyzabad for giving me the opportunity to represent them in this August chamber. And before I go further, Mr. Deputy Speaker, I would want to congratulate the Leader of the Opposition for her excellent presentation, showing that once again she understands the needs of the people of Trinidad and Tobago, and with the policies that she would have advocated in her response to the budget, that she is prepared, willing, and able to move this country forward. Mr. Deputy Speaker, I also want to congratulate my colleagues who have spoken before me in this debate. Some very heavy contributions from my colleagues, member for Karen East Central, my medical colleague from Komoto Manzelina, my colleague from Ruga Tablan, and of course, Point Appear this morning, very fiery, and colleague from Appropriation. So, Mr. Deputy Speaker, I listened to the Minister of Health. I was taken aback a little bit in shock in terms of his contribution, but to say that there are two aspects to this, to the health sector. And I want to say at the very outset, both as a medical doctor and as a member of Parliament, that I do agree that the approach of health and wellness is important for our country. We on this side agree with the approach of primary health care, and we understand that there are many of these policies that will benefit Trinidad and Tobago, will benefit the health of our people. We know a healthy nation is a productive nation, and we would be willing to to support many of these measures, many of which were already started during our time in government between 2010 to 2015, and I'll come back to talk a bit more about that. But also, Mr. Deputy Speaker, I want to make it very clear at the beginning that, whilst all of these measures are important, and while primary care is important, at the same time, it's very important to recognize that while we are taking a preventive approach, and all of these measures that are outlined, at the same time, there remains the issue of secondary care, the issue of treating with the problems that we see, and I welcome you, Madam Speaker, the issue of treating with the problems that we currently face and that citizens of Trinidad and Tobago currently face in the health sector. And many of these problems, in fact, are related to the complications of diabetes and hypertension. And I have a few suggestions I would want to make to the Minister of Health in my contribution, and I hope that he would be kind enough to give them consideration. But, Madam Speaker, again, before I get to that point, I just want to address some of the points made by the Honourable Minister of Health. And again, he mentioned the Children's Life Fund, and I just again would want to thank the Honourable the Leader of the Opposition, then Prime Minister, for initiating the Children's Life Fund. I'll say no more on that. Madam Speaker, with regards to the NCDs and so on, there are many points here I'm in agreement with. I'll come back and deal with some of these with regards to the contribution I have prepared, and especially with regards to the new approach that is being suggested with regards to teaching and so on. So, Madam Speaker, to get into the meat of my contribution, so to speak, soon after the Minister of Finance presented his budget last Monday, one of my constituents called me to give his opinion of the budget. He called it a 4-for-3 budget. So, Madam Speaker, I sought clarification as to what he meant by this, and he said, well, in simple language, the minister spoke for 4 hours to give us $3. I suspect he was saying that the $3 referred to the increase in the minimum wage. But, Madam Speaker, I just make that point to show that, this simplistic analysis of the budget reflects really how many citizens thought about the budget. You know, sometimes it's important when you're preparing for a contribution, you know, to listen to what your constituents have to say on the ground. Madam Speaker, I will go into some of the issues directly. Many of the points that were raised by the Minister of Health. But before I do that, I just want to say, again, if we look at the figures, you know, the question really has to be asked that over the last 8 years, with the approximately $50 billion that has been spent in the health sector, whether the citizens of Trinidad and Tobago are getting value for money. This is something that has to be asked, Madam Speaker. It's a budget debate, and we always have to look for value for money when we discuss taxpayers' expenditure. And the question really is whether that is we are getting value for money. And many will say that the answer is no. Madam Speaker, the other issue here would be, of that approximately 50 billion, about 35 billion has been allocated to the RHEs. And again, the question is being asked, is the public health sector better off than it was 8 years ago? The Minister of Health, member for St. Joseph, you know, would have, you know, painted a very rosy picture, but it's really a picture, it's a futuristic picture of where we are aiming to go, but he has made no real effort to address some of the current problems that we are facing. And as we speak to allocations to the RHAs, again, there are certain issues that are arising within the RHAs in terms of the provision of services and in terms of infrastructure upgrades and so on. So, Madam Speaker, really and truly, what is the status of the public health care, of the public health sector in Trinidad and Tobago? Let us take an honest look at the reality of the state of our public health sector. One of the biggest problems that we have currently is the access to timely public health care. This remains a major issue. Now we know, Madam Speaker, that, you know, healthcare services in the public sector are free at the point of delivery. This is a given, but it is also important to understand that the timeliness of access is important. Because you can have access, you can have free access, but at the same time, if you have to wait a long time, then there can be implications to that. There will be complications, and of course, it will be situations where, in fact, it wouldn't matter at all if there was a long waiting time, Madam Speaker. So we still have the issues, and you know, when I prepared for this budget presentation, Madam Speaker, you know, I perused the previous contributions over the past 3 or 4 years in the health sector. And, you know, I found that many of the issues that were raised and addressed and so on are still to be fixed in the health sector, Madam Speaker. So we still have the issue of, you know, of long wait times for clinic appointments and surgeries. And if you have constituents who come to my office on a daily basis begging, you know, for help in this regard, you know, admittedly, the Minister of Health, I must say, will assist in some instances when I send requests. But the question that has to be asked is, what happens to the other patients in the meantime, especially those who cannot access private health care? So we still have an issue with long waiting times to see a doctor in accident and emergency departments, to get a bed in our public hospitals sometimes, to get a CT, an MRI, and ultrasound investigations. And even, Madam Speaker, when the patients do get these investigations, you have a situation where it takes a long time to get the reports. And this is an important factor that I thought the member for St. Joseph would have addressed, because it's no point you getting an investigation and then you get the result 2 months, 3 months later. It doesn't make any difference at that point in time. And therefore, this is something that has to be addressed, and especially with the promise of this government to include and incorporate technology, this is something that can be done in terms of reading MRIs and CT and generating reports and so on. And of course, we have the issue of getting outpatient clinic appointments and getting surgeries, a long waiting time for that. And again, that has come out of the COVID pandemic in terms of the promise. You know, we were told that there was a parallel healthcare system, Madam Speaker, when in truth and in fact, there wasn't a parallel healthcare system. And what we are seeing right now in the health sector is the chronic disease depth, which was outlined by the Simongal report. And I believe this is what the government needs to address in a very serious way. Madam Speaker, the other issue that still remains with us is the issue of the shortage of drugs and supplies. This seems to be a recurrent problem. And one of the things that I've raised in this Parliament with regards to drugs and supplies, Madam Speaker, there is a particular line item in the budget, which I look at very carefully every time the budget is presented. And one cannot help but notice that, Madam Speaker, from a high of 617 million allocated in 2015 under this line item, this dropped to 252 million in 2022. And despite all of the attempted explanations to explain why there was this decrease, I am still not satisfied that this amount, this big difference, was supplemented over the years from especially from 2020 when that big drop was noticed. I'm happy to see that, in the figure for 2024, according to the budget documents, is now back to 574 million, closer, not quite there, but closer to what it was in 2015 of 617 million. But I just want to ask, Madam Speaker, whether this substantial increase now is to pay for the much needed drugs and other related materials and supplies. In fact, I want to ask you as well whether with this increased allocation, the public can now expect to have available a new diabetic medication for SIGA, which also has a beneficial effect in not only lowering your blood pressure, but giving good heart and kidney protection, something which the Minister was speaking about. And Madam Speaker, I also want to ask whether with this increase in the allocation, whether renal dialysis patients will have access to a drug called Zemplar, Z-E-M-P-L-A-R, which has bone protecting effect. And I'll come back and talk a little bit about renal dialysis and chronic kidney disease, Madam Speaker. And I really hope that this allocation will be to add new drugs to the health sector, make it available for patients as opposed to servicing new loans. But I guess we'll find that out soon enough in this next stage of this debate, Madam Speaker, in the Standing Finance Committee stage. Madam Speaker, the other issue here that we often face, and we get this by way of complaints in the public domain, by way of media reports on many occasions, and this is regarding the lack of or the poor maintenance of medical equipment. And quite often you'll have patients whose surgeries and so on might be postponed because they're told that the equipment is not functioning or it's broken down, and then they have to be given new appointments, and that's another story as to when they will get their surgeries. But let us look, if I may, Madam Speaker, let's look at how the budget addresses this issue by way of one example. And I will just look at the SWRHA, the PSIP allocation, which is under medical equipment upgrade, page 125 of the budget documents. And I see here the replacement of 2 C-arms for occupational therapy, 3 blood gas machines, 2 operating tables, and 20 vital signs monitors. Madam Speaker, as one who has practiced in the public health sector for over 20 years, I'm always happy to see allocations for new equipment and upgraded equipment in the budget. But Madam Speaker, I also look very carefully when I look at this budget item for allocations for other essential equipment that I know medical staff have asked for to do their jobs effectively. And I want to speak here specifically of the issue of something called the phaco-emulsification machines, Madam Speaker. We call it a phaco machine for short. And these are required to do cataract surgery. Now, the Minister spoke a whole lot about the complications of diabetes and so on, and what the government intends to do to prevent the complications of diabetes. But, Madam Speaker, cataracts is one of the issues that occur in the elderly. It is something that needs to be treated. And there was no mention at all made of how the Minister and how the government intends to deal with the backlog of cataract surgery. And I speak only here of the backlog at San Fernando General Hospital in the SWRHA. If you were to just take that example, Madam Speaker, because from a newspaper report, and I can quote here, this is the 1st of July, 2023, the Trinidad Guardian, Cataract surgeries halted at San Fernando General Hospital, and it tells us at that time of 200 patients who have been awaiting surgery, and surgeries were suspended because the issue has been that the two phaco machines, these are the machines that are important in terms of doing the cataract surgery to replace the lens. Those two machines are old, they're broken down, and the SWRHA is in the process of trying to procure new machines. In the meantime, the old machines were repaired. The doctors found they were not satisfactory or safe, Madam Speaker, and the doctors are entitled to not perform surgery if the machine is not safe and can endanger lives. But anyway, Madam Speaker, the point is that the tender was issued by the SWRHA for two phaco machines with a deadline of August 25th. We are now in October, and my information is that cataract surgeries have not yet resumed at San Fernando, which means that there's a backlog of cataract surgery. So the minister comes here and says, well, okay, fine, he wants to address the issues, of the complications of diabetes, but yet here we are seeing a situation where what needs to be done in terms of providing the resources is not being done. Now, the other thing that is of concern to me here, Madam Speaker, is that, in addition to asking what is the status of the tender for these two machines, I want to ask here, is it true that stakeholders at the San Fernando General Hospital are being asked to modify the specifications of this critical piece of equipment to facilitate a particular supplier? This is what I'm being told, Madam Speaker. I am being told, reliably informed, that the delay in procurement of these two machines is because this is what is happening. So I just throw this out, for an answer, Madam Speaker, because, and if I look at the SWRHA PSIP allocation, I see no mention of a phaco machine under the PSIP for SWRHA. So I'm taking it that the Ministry of Health is taking it upon itself to procure these two machines and then disperse it to the RHA. But I leave that there, Madam Speaker. That is something that, that I hope can be answered in the fullness of the debate or otherwise. And I trust that the member for St. Joseph will find a solution to this problem, and very soon those patients who are waiting for the cataract surgery, that service can be resumed and those patients will get their surgeries, Madam Speaker. So I will leave that there and I will move on. So, Madam Speaker, whilst patients are waiting for this piece of equipment to be procured, what are the recourses there from the budgetary point of view, from the allocation? What other access does the Ministry of Health have to deal with this? Well, there are a couple of programs available to the ministry and the minister, Madam Speaker, and I speak of something called the External Patient Program. There's something called the Waiting List Initiative, and there's something called the Medical Treatment of Nationals in Institutions. These are all budget items for which allocations are made by the Minister of Finance annually that allows and gives the Ministry of Health and the Minister of Health the leeway to deal with situations like this. In fact, this is why the External Patient Program was developed under the People's Partnership Government, just for situations like this, Madam Speaker, so that you can outsource some of these procedures in a situation where the equipment is being procured and so on. So to what extent, I have to ask, have these programs been used to bring relief to patients waiting on cataract and other surgeries? So let's look at this then, Madam Speaker. Has this program been used? Let us look. And it is very worrisome here, Madam Speaker. If I just throw one example, out of an estimate of 9.7 million, which was allocated in financial 2023 for this program, I'm taking the waiting list for surgery as an example, only 700,000 was spent. I had to read that twice, Madam Speaker, in the book. The books are saying, these books provided by the Minister of Finance and the Ministry of Finance and the government, that out of an allocated 9.7 million in financial 2023, only 700,000 was spent. So the question has to be asked. You have patients waiting on surgery. but you've only spent $700,000 out of $9.7 million. So what happened to the long list of patients awaiting surgery? Why was this relatively small amount spent in 2023? Is it that the funding was not released by the Ministry of Finance, Madam Speaker, I ask? Was it a capacity issue? Was it some procurement issue with private providers? So I think, Madam Speaker, the Minister of Health, the member for St. Joseph, owes it to the population to explain to his ministry, while you have so many patients waiting for surgery, why his ministry was only able to spend $700,000 out of the $9.7 million, while those were left suffering for surgery. And that's just an example, Madam Speaker. I leave that there. Madam Speaker, the member for St. Joseph again spoke of all the nice programs and policies that his government was proposing. But of course, all of these programs will require staffing, Madam Speaker. And again, I come to the issue of staff because this is an ongoing problem. This is something that creates a situation. Nothing can be done without the adequate and proper staffing, Madam Speaker. I will not go into the issue of nurses. I know my very experienced colleague, member for Komoto Manzala, that dealt with some of the issues with regards to nursing shortages. But I just want to point out, Madam Speaker, and refer to a special report of the Auditor General of the Republic of Trinidad and Tobago, which examined the performance of this government in the health sector between 2016 to 2021 with regards to our progress towards SDG Goal 3 Target D. Basically, that is really to look at how we were looking at treating with mortality from NCDs and so on. And I will not go into detail in the brief there, Madam Speaker, but just to say, Madam Speaker, that a key finding of this report was this. The key finding was that the provision of human resources needs strengthening to meet the demands of the public healthcare system. This is what this special report found. This report was done in conjunction with the WHO and the Ministry of Health. And in fact, one of the worrying things about this is that the WHO recommendation in terms of staffing, and we have to look at staffing per 1,000 of population, this is how it's compared internationally. The WHO recommendation is 4.45 doctors and nurses and midwives per 1,000 population. And Madam Speaker, it is very worrying to know that at that point in time, up to 2021, and I'm sure it's no better now, that in our situation, we have a ratio of 1 doctor, 1 nurse, and 1 midwife per 1,000 population. So it speaks, Madam Speaker, to the tremendous challenge that we have in terms of providing staffing. Madam Speaker, this very report goes on to say, and again, it hits the nail on the head here, in terms of saying that approximately 17,682 positions directly linked to providing patient care across 4 RHAs, 37.6% of the established positions were vacant at the end of 2021. So, Madam Speaker, the question really, and again, one would have expected and hoped that the Honourable Member for St. Joseph would have come with some sort of plan to tell us about what the government was going to do to address this shortage in the health sector. Let me just examine this a little bit further, Madam Speaker. And I want to use data which was provided by way of written answer to recent questions posed in this very Parliament, Madam Speaker. So it is information from the Ministry of Health, from the Minister's own ministry. So if we look at the positions, let's look at the hospitals. Let's look at the Arima Hospital and the Point Fortin Hospital. New hospitals which the population now has access to. But the question is whether the services that the population expects is being provided. Some of these figures were already mentioned by the Leader of the Opposition in her contribution with regards to doctors and nurses. But what about other situations, Madam Speaker? If we just look at the Arima Hospital, for example, if you look at positions for radiology, 59 on the establishment, only 35 filled. Laboratory, 79 on the establishment, only 25 filled. Supply chain management, 6 on the establishment, 2 filled. Quality improvement, 9 on the establishment, 0 filled. HR and finance and so on. And if we look all across, we see that there's quite a deficit in terms of the staffing, not only for doctors and nurses, but all the support and ancillary staff that is required to provide a proper service. Madam Speaker, the Minister alluded to primary health care. Again, I want to say that, we on this side, we support the initiative of primary health care. We understand it's important. But talking about it is not going to make it happen, Madam Speaker. And again, if we look, this is another question. I have the written answer here, which was provided. Question to the Minister of Health. And this question asks for a breakdown of staffing by different RHAs. And when I looked at the answers here, and I looked at the Minister's contribution, and, very airy-fairy, and, asking the population and so on to engage and, to embrace the ideas and so on, all commendable. But then what happens when we look at the reality? And again, I'll just quote examples. There's a big voluminous document. It's available. It's laid in the Parliament by way of answer to a written question, a written response. And if we take, for example, the Eastern Regional Health Authority, and we look at the category of district nurse, we see that of 45 positions, only 30 are filled. Why do I choose district nurse? Because these nurses are very important in the primary healthcare setting. MP for Kumoto Manzolina, correct. Yeah, they go out and they look after the patients and so on. Again, and if you go across the answers in this document, Madam Speaker, you will see in some very critical categories, midwives, for example, in the ERHA of 60 positions, only 12 are filled. And if we look at the other RHAs here, there are some very critical positions with regards to how primary health care will happen. And we see here that there's a critical shortage in terms of staffing with regards to all of the RHAs. As I say, Madam Speaker, this document is available. I will not go into all of the details, but the point I'm making is that the staffing does not appear sufficient for what the Minister is proposing. Madam Speaker, the Minister spoke about the staff and making Port of Spain Center of Learning and so on, and spoke about the young doctors that are unemployed, and made the point that, that we have a shortage of specialists and subspecialists. The point I want to make, Madam Speaker, is that, for you to become a specialist, you have to go through a period of training. You're right? You do an internship. Your expectation in the course of training is that when you finish your internship, you occupy a position called a house officer in the public sector, which is where you get your experience. And of course, after becoming a house officer, you become a registrar, and then you can become a specialist. So the point about it is that how are you going to get these specialists, short of importing them, from abroad, which can also be a challenge. And the way it has traditionally been done until 2015, 2016, when the government changed, is that interns were automatically guaranteed a position as a house officer in the health system, and they fell into a pattern of training. But that is no longer happening. Instead, what is happening, Madam Speaker? You have short-term contracts, which creates a lot of uncertainty, and it depresses the morale of doctors, as we saw. And of course, it impacts negatively on the training of these recently graduated doctors. Madam Speaker, we have to note that millions of taxpayers' dollars are spent annually to train these doctors, and there are currently over 400 doctors, some of them having graduated as long ago as 2019. They are unemployed, and therefore citizens are not benefiting from this investment of taxpayer dollars. So I want to urge the Minister to look at ways in which these young doctors can be meaningfully employed, Madam Speaker, as we go forward. Now, Madam Speaker, The Minister, of course, spoke of the issue of maternal deaths and neonatal mortality. Madam Speaker, as an obstetrician myself, I am very happy for the state of affairs in the maternity sector. However, it would be remiss of me, Madam Speaker, to not commend the then Prime Minister of the People's Partnership Government, Kamala Persad-Bissessar, Prime Minister at that time, for laying the foundation, Madam Speaker, for these gains. I think it's important to put that on the record, Madam Speaker, because that, under her leadership, a report was commissioned into the maternity services in 2011, following the unacceptable situation which the People's Partnership Government met in 2010 in this area of the health sector. I want to say, suffice it is to say that the member for St. Joseph acted quickly on the recommendations of this report when the government changed, and pregnant women and their babies are now reaping the benefits. Madam Speaker, we are happy for that. We are happy for that. But, Madam Speaker, before I leave this issue, the member spoke about maternal mortality. It's his favorite thing. It's my favorite thing too. I'm happy. But it shows how we can work across the board as governments. And you can build on one platform, Madam Speaker. But I just want to speak about the issue of neonatal mortality. Neonatal mortality, Madam Speaker, is, with regards to babies, how many deaths you have within the first few weeks after birth. And if you were to listen to the member for St. Joseph, Madam Speaker, you will think that somehow miraculously from 2016, these changes has happened. But I have in front of me here a document, Madam Speaker, which is a UNICEF document relating to these figures for Trinidad and Tobago. And I just want to read these figures into the record, Madam Speaker, because we are speaking here about neonatal mortality rate, NMR we call it, and it speaks to deaths per 1,000 live births. And let's look at the figures, Madam Speaker. 2010, 14.4. 2011, 14.0. 2012, 13.6. 2013, 13.2. 2014, 12.8. 2015, 12.4. Madam Speaker, during the years 2010 to 2015, we already see that there was a decrease in neonatal mortality rates. And Madam Speaker, again, that speaks to the measures that was implemented and that started under the People's Partnership Government. And those measures were so good, Madam Speaker, and they were embraced so quickly by the member for St. Joseph that the improvement continued, and I'm happy for that. In 2016, it dropped to 12. So 2015, we left it at 12.4, 2016, 12.0, 2017, 11.7, 2018, 11.3, and so on and so on. So it's come down, and again, that is a sustainable improvement. I'm happy, to say that, Madam Speaker. But, Madam Speaker, in addition to that platform which the member for St. Joseph met and the government met, this government here would have met another sound platform on which to build. And that is the Couva Hospital, Madam Speaker, which was completed in 2015 and not 2016 as erroneously reported in this budget statement here, Madam Speaker. I'm not sure if the Minister of Finance corrected himself, but I guess the report in the budget is what he was told, but it was completed in 2015, Madam Speaker, August 2015, and the commissioning process for that hospital began in September of 2015. Of course, the government changed. It's another story, Madam Speaker, but I just want to say, had the member for St. Joseph opened the state-of-the-art facility when he took office, a lot more citizens would have benefited. And, Madam Speaker, it is now history that this 230-bed facility was denied to the public until the COVID-19 pandemic forced them to open it in 2010 in a short space of 2 weeks, Madam Speaker. And, Madam Speaker, I will leave that there. I will leave that there. The population, the people of Trinidad and Tobago will have to judge for themselves what happened between 2016 and 2020 to this state-of-the-art facility, which they were denied, and patients, it's a sad story, Madam Speaker. Patients would be traveling in ambulance from the Couva District Health Facility to go down to San Fernando to wait for a bed, right? And they were bypassing this brand new facility on the way. We leave that there, Madam Speaker. So, Madam Speaker, I just want to come back briefly to the issue of the unemployed doctors, because I have some information which has come to me, Madam Speaker, and I just want to ask again, I want to ask, what is the process for engaging these doctors who have just completed their internship, who have applied for a house officer position? What is the process for doing this? And I want to further ask the Minister of Health, through you, Madam Speaker, to investigate claims that at the Arima Hospital, contracts are being awarded to certain junior doctors ahead of those in line with longer service because they have friends in management and other high places. I was just told this, Madam Speaker. I'm just asking the question, Madam Speaker. Surely this cannot be the policy of the NCRHA, or indeed at any other RHA under this Minister's watch. Or is it that the most senior administrator at the NCRHA doesn't have to report to the Minister? I'm just asking, Madam Speaker. And Madam Speaker, as I mentioned this, and I mentioned at the Arima Hospital, I'm not sure if this is happening at the other hospitals, this thing that was dropped off, is worrisome. Discrimination is a claim here. We are being told here that the majority, and this is the COVID-19 junior doctors who were promised certain things for serving, and again I want to thank all healthcare workers who served during the COVID-19 pandemic, Madam Speaker. But Madam Speaker, how are they being treated now by this government? We are being told that the majority went from one-year contracts to locum contracts without any reasoning. What happens when you have a locum contract? You have no vacation days, you have less pay, you have no gratuity, you get no sick days. You're unable to get a loan or mortgage and so on. So the promise of job security for these who dedicated their lives to the service of the country during the COVID-19, that promise of job security was never met, There's a claim of, victimization and oppression at the Arima Hospital. If anyone speaks out, he or she will be transferred to another hospital or forced to resign. So, Madam Speaker, I want to, ask the Minister to look at these claims. I'm sure that under his watch, this cannot be true. Another thing that is being told, Madam Speaker, is that whilst the Minister is investigating these claims, I also want him to check into the allegation that senior staff are being paid for duties at the Arima Hospital, whilst the majority of major surgical cases and other cases are being diverted to the Eric Williams Medical Sciences Complex, Madam Speaker. So perhaps the member for St. Joseph can look into this. I'm sure that the member for Arima cannot be in agreement with this state of affairs with a hospital that is in her constituency, Madam Speaker. So, Madam Speaker, I will leave the issue of unemployed doctors. I've dwelled enough on that. But I just want to leave on one point. It reminds me, the current situation reminds me of an analogy that a lecturer once made while I was a medical student. It's stuck in my head with regards to the description of diabetes.
The offenders will just go outside and get it under control.
So, Madam Speaker, thank you. So, Madam Speaker, the analogy, the definition of diabetes was starvation in the midst of plenty. And we're talking about diabetes here today, Madam Speaker, indulge me. Starvation in the midst of plenty. What does that mean? When you have diabetes, you have a lot of sugar in your blood, but your cells are starved for sugar. So you have starvation in the midst of plenty. So, Madam Speaker, this is exactly what we have in our healthcare system. Madam Speaker, an abundance of unemployed doctors in the country, whilst patients starve for proper healthcare in our public institutions, Madam Speaker. Madam Speaker, I want to come to the issue of governance in the RHAs, because we mentioned, we looked at the allocation in my introduction. I looked at the allocations for the RHAs. There are substantial allocations to the RHAs every year. It amounts to the sum of $4 billion out of the approximately $6 billion that is allocated to the health sector. And I want to speak again to the issue of management and the management issues at the RHAs. But before I go on to that, Madam Speaker, I just want to note an anomaly. Well, I shouldn't say an anomaly. It's something that I have to note here with regards to the allocations. And I look at the allocation for the NCRHA for 2023 and 2024, and I notice, Madam Speaker, that there's a decrease of $139,643,600 decrease allocation to the NCRHA. And for the SWRHA, there's a decrease in the allocation for 2024 of $33,399,700. And I just want to ask, again, if it is that you're looking at programs, you're talking about doing this and doing that, Madam Speaker, and you have these decreased allocations to these RHAs, how does that add up? And again, hopefully we'll get some answers at the committee stage of this debate, Madam Speaker. So what do I speak of? I just want to give two examples. And again, this is important because these things affect patients, it affects members of the public, Madam Speaker. And I want to bring this up because I hope it's fixed, Madam Speaker. And I speak of the pileup of the biohazard bags at the San Fernando General Hospital, which was reported in the Express of the 28th of August, 2023, and the Trinidad Guardian at the same time. And I want to ask the Minister as to if he can give us an update as to what is the status of the incinerator at the San Fernando Hospital. Because, Madam Speaker, these newspaper reports, an appalling situation where you had images of hundreds of bags of rotten biohazard waste lying in the compound of the San Fernando General Hospital. And in a press release, this SWRHA admitted to the problem, Madam Speaker. And their description, the PR person must be well paid because the PR person admitted to this situation where you had a stench, you had bags of all of this stuff accumulating in the compound in full view of the public, Madam Speaker. And what was the explanation, Madam Speaker? This is the explanation. The transient accumulation of waste that occurred due to some transitional staffing issues is currently receiving the attention of the Human Resources Department. Such was the disingenuous comment by the PR person for the SWRHA, who was making light of a very serious situation. But, Madam Speaker, I want to ask, because I noted there was an article in 2014 which spoke of a new medical waste incinerator which was installed at the San Fernando General Hospital. I'm very familiar with it, Madam Speaker. I was there as chairman of the SWRHA when that was installed. But I want to ask the Minister today, is it true that this state-of-the-art incinerator was allowed to fall into disrepair because of a lack of maintenance and failure to purchase parts by the SWRHA over the past few years? Sounds like a familiar thing, Madam Speaker. Neglect, of equipment, then it becomes, situation where it can't be fixed. And I also hope that the Minister will, in some way, explain why the autoclave that was gifted to the government and intended to replace this neglected incinerator has taken over a year to be commissioned. And in fact, Madam Speaker, whether this new autoclave has been commissioned and is now available to deal with this biohazard and the waste material at the SWRHA. The other issue of governance refers to the NCRHA. I want to draw attention to the power outage at the Eric Williams Medical Sciences Complex, as reported both in the newspaper and confirmed via press release from the Corporate Communications Department of the NCRHA, Madam Speaker. The NCRHA has a very good corporate communications department. I see full-page newspaper ads ever so often, Madam Speaker, highlighting clinics and so on, these walking clinics and so on. Very expensive ads, but one wonders whether this kind of money that is paid for the ads cannot better be used in terms of dealing with issues, real issues within the RHAs, Madam Speaker. So we are seeing here where in July a major power outage was reported at one of the nation's largest hospitals. And by way of a media release from the NCRHA, the public was informed that the situation was caused by a malfunctioning transformer. As a result, load shedding was required with resultant impact on services Indeed, Madam Speaker, and this is where I became concerned. Current go lies all right. But when you have to move 8 ICU patients, you have to transfer them from Mount Hope to the Arima Hospital. It's a serious thing, Madam Speaker. To move a patient from ICU to the Arima Hospital because of a power outage, that's a serious thing. Madam Speaker, I am told that, somebody died on that night, and that's currently the subject of a lawsuit. I can't go into that further, Madam Speaker. But you're talking about a situation where a hospital, you have the power supply, an issue like this. And in addition to that, Madam Speaker, a number of patients had their renal dialysis curtailed on that day. Several major elective surgeries were postponed because of a power outage. So, Madam Speaker, I want to ask whether the member for St. Joseph has received the incident report on this particular incident, Madam Speaker. But, rather than wait for the minister, I looked at the budget document for an answer, Madam Speaker. All these.
Honourable Member for Fyzabad, the original time is now spent. You're entitled to 10 more minutes to complete your presentation. If you wish.
Thank you, Madam Speaker. So, Madam Speaker, I will just move on, just to ask whether this problem has been fixed, because my perusal of the budget documents showed an installation of an automated load shedding system for the electrical distribution system has been 15% completed in 2023. But of note, Madam Speaker, is that in the 2024 budget, nothing is mentioned of this automated load shedding system at the Eric Williams Medical Sciences Complex. 15% completed in 2023, nothing in 2024. There's a kind of magical gap there, Madam Speaker, that perhaps, again, we might get some kind of answer at the next stage of the debate. So, Madam Speaker, I want to move on quickly, and I'm happy to hear that for how many times, Member for St. Joseph, the San Fernando General Hospital Cardiac Catheterization Lab has been promised, Madam Speaker. This has been promised from 2016, every single year in this Parliament. I urge the population of Trinidad and Tobago not to hold their breath, Madam Speaker, but I live in hope. I live in hope. Madam Speaker, I have 2 pages here entitled The Saga of the San Fernando General Hospital Cardiac Cath Lab. Because of time, I will not go into the details of this saga. I also have here 2 pages of answers to questions I posed in this Parliament since 2016 regarding the cardiac cath lab, Madam Speaker. But I just want to say that I hope that the people of Trinidad and Tobago will finally get their cardiac catheterization laboratory, and that will go a long way, Madam Speaker, to saving lives in Trinidad and Tobago. And whilst I agree with the member for St. Joseph that the lifestyle changes are important, at the same time, there's a burden of heart disease, Madam Speaker, and there's a burden of kidney disease, which I'll speak to briefly in a moment, Madam Speaker, that needs to be treated with as we go forward, Madam Speaker. So, before I leave the issue of the cath lab, Madam Speaker, there's also something that bothers me, and we don't have a cath lab. We have a high burden of cardiac disease. And again, Madam Speaker, these figures jump out at me when I look at the budget documents. And I had to ask, Madam Speaker, when I looked at the budget document, why in 2022 only 5 million was spent out of an allocation of 20 million for an item which is the treatment of adult cardiac disease, which comes under the PSIP. So again, you have the opportunity, you have the allocation to outsource these procedures, to outsource these investigations, because you don't have the in-house capacity. You are allocated 20 million, but yet you only spend 5 million. And I'm sure, Madam Speaker, the question will be asked, minds of the public, how many patients suffered, how many patients perhaps would have died whilst waiting for these very critical and important procedures, Madam Speaker. So I just want to say, Madam Speaker, as I said, the Minister promised that it will happen in this financial year. It's a promise that's been repeated every year in this Parliament with this budget. But I want to say, Madam Speaker, I want to put this government on notice that I will continue to advocate for this cath lab, not only in this budget, but in the mid-year review of this budget, Madam Speaker, I will continue to advocate for this, Madam Speaker. Madam Speaker, if by some miracle those on the other side are still in government come the next budget, Madam Speaker, I again will continue to advocate for this, Madam Speaker. But, Madam Speaker, the people of San Fernando were not left. I mean, they were not given a cath lab, but they were given 150 million parking facility at the San Fernando General Hospital. And the irony of all of this, Madam Speaker, is that the free parking that was previously available for those relatives who had to come and wait long hours to look after the loved ones now have to pay to wait, Madam Speaker. I say no more on this, Madam Speaker. So, Madam Speaker, with a few minutes remaining, I want to come to a very important issue, something that is close to my heart, Madam Speaker, and that's the issue of renal disease and renal dialysis in this country, Madam Speaker. And again, I want to say we support the lifestyle changes, but the interim, you still have in the region of about 1,500 patients who require renal dialysis in this country. So, Madam Speaker, and again, I have to agree with the member for St. Joseph, who in a post-budget televised program noted that the NCD burden on this country is $6 billion when you look at the expenditure, plus direct expenditure, plus the indirect cost of the lack of productivity. So I think it's important that all measures to treat with this are dealt with. So I am with the government on this issue. We are on the side, we are in the government with this issue, Madam Speaker. And I'm very passionate about this, Madam Speaker, in terms of doing our bit to treat with the NCD burden. You know, Madam Speaker, I'm 65 years old. At this age, I'm not there are very few things which can excite me, Madam Speaker. I've seen a whole lot, I've done a whole lot. But you know, Madam Speaker, the issue, Member for St. Joseph, of treating with NCDs, I'm on board with you for this, you know. I am on board with you. Because you see, this speaks to my heart, Madam Speaker. 40 years ago, I had to make a choice between becoming an obstetrician and gynecologist or becoming a public health specialist, Madam Speaker. I chose the previous, I'm very happy, I'm very satisfied for the 40 years I've practiced as an OB-GYN, but I'm excited about public health aspects, because it gives you a chance to treat with the whole population, In my specialty, it's satisfying. You deliver a baby, mother and baby are fine, and so on, and that's good. But here we have to look at the whole population, together with the hat I wear as a member of Parliament, Madam Speaker. So I am with the government on this issue. So can you imagine my joy, Madam Speaker, when the Minister of Finance in his 2022 budget presentation announced a National Center for the Treatment and Management of Renal Disease. That's there in black and white in the 2022 budget statement, Madam Speaker. This was part of a promise to deliver centers of excellence in the health sector. Big and bold promise, Madam Speaker. But, Madam Speaker, lo and behold, in the 2023 budget statement, the National Renal Center disappeared. Madam Speaker, with a wave of the Umbertian wand, as someone described it, Madam Speaker, the item disappeared. But unlike the recurrent decimals of the TTRA, the property tax, the gaming commission, and so many others, this budget item is yet to reappear, Madam Speaker. Madam Speaker, this is a sad blow. This is a sad blow for those who suffer with chronic renal failure and require renal dialysis, and comprehensive care, Madam Speaker. Madam Speaker, I want to speak briefly about the special program called renal dialysis, which is in the PSIP, Madam Speaker. And, again, I want to ask a question. Because this weekend, Madam Speaker, as we speak about kidney disease and renal dialysis, Madam Speaker, there's a very sad situation which occurred, Member for St. Joseph, at the San Fernando General Hospital this weekend, where on Saturday night, a 49 years young woman renal failure, was admitted to San Fernando Hospital. In the evening, after hours, required something called emergency renal dialysis. Her creatinine was 50, and the member was talking about HbA1c. He's familiar with some of these terms. 15 is very high. You're in kidney failure. You require emergency dialysis. And do you know, Madam Speaker, that was not available at the San Fernando Hospital as an emergency. Sadly to say, Madam Speaker, the patient demised the next day. I'm not saying that that was the only reason for the demise, but Madam Speaker, I'm asking the member for St. Joseph to ask those in charge at the SWRHE, and I can't speak for the other regions, why it is, with so much expenditure in the health sector, that facility is not available to patients on an emergency basis. And I think that is something that the minister should look at, Madam Speaker. So, Madam Speaker, I just want to close because we have a lot, there's a lot in the public domain about the renal dialysis, but I also want to ask about the state of our renal transplantation service. Because, Madam Speaker, the ultimate cure for many with end-stage renal failure is a kidney transplant. And you know, Madam Speaker, I just want to quote.
Have about 30 seconds left.
Oh, thank you very much, Madam Speaker. I just want to say that I want to encourage all citizens to look at this article in today's Express, Save a Life, Become an Organ Donor, with regards to becoming a donor, and signing up for the donor transplant program, Madam Speaker. With those few words, I thank you very much.